Hi, just one moment, please. 1 second. Okay, patient of the day. Checkup, dental. Perfect. Okay. Just going to put that aside. Hi. Hello. Nice to see you here. Yes, I understand. I just read your file, so you're in here for just a checkup. And how have you been feeling? Any problems? No? Soreness at all? No? Okay. Yes. And how are you since the last time I saw you? Keeping your teeth clean, I assume. Okay. And are you brushing twice a day or consistently every day? Okay. To be honest, you should definitely be brushing twice a day, but we're human, we forget. The most important time, however, I would have to say would definitely be before bed. Okay, if you can only do it once a day, definitely aim for before bed. And you're flossing, how are you doing with that? Okay. Flossing twice a day is too much to ask of anyone, I understand, but if you can aim for once every other day, that would be fantastic. It is really important to floss, I know. Something that we constantly forget, so yeah, if I could just have you brushing twice a day, flossing once every other day, oh, you'll see that your dental hygiene will be improving drastically. Oh, yes. Okay, so let's begin. You just have a simple checkup today, so nothing overly invasive or uncomfortable. Okay, I'm just putting my gloves on. Yes. No, it's nothing to be worried about. Are you comfortable in your chair? Just sit back and relax, okay? Just getting my trusty gloves on here. So when is the last time I saw you? When were you in here last? Okay, so you're overdue for a checkup. Not a problem. So we will just be checking for, cavities, all that good stuff. And how are those wisdom teeth of yours? Are they giving you problems? Okay. We'll check on those as well. So I'm just going to get my light and I'm just going to have you, just relaxed. Okay, so just open your mouth. I'm just going to be looking at the bottom row right now. Just a quick look, nothing too invasive. Okay, looks pretty good. You should be brushing. You would notice a difference, yes. So just please aim for twice a day, okay? Nothing too crazy, a little bit of some buildup over there, okay? I'm just gonna check briefly this other side, okay? Yep. Okay, can you just stick out your tongue for me, please? Okay, perfect. And I'm just going to be looking at the top row, okay? Yes. Yep, just say, perfect. Just a quick look. Okay. Do you find that you brush a little bit too hard? Okay. Yeah. So I'm going to recommend that you use a softer bristle, but now I'm just going to get in there. Is that alright? Okay, I'm just going to have a little quick look, see, okay. Okay, scraping that off, okay. Okay, yep, no. Is it uncomfortable? Okay. Yeah, just a little slight tickling. Okay, I'm just going to be scraping off. Okay. Yep, just say, okay, perfect. I'm just going to get in there. Like, to the back. Okay. Just going to move my light over, okay? How's that? Is that okay? Alright, good. Great. Okay, so I'm just going to scrape off some of this tartar buildup, okay? Okay, top. How's that? Okay. Okay, yep, you can close your mouth and swallow. Open again. Thank you. Great. Just getting this side. No worries, no worries. Okay. We seem to have a little bit. Are you left-handed or right? Okay. I can see you are brushing a little bit harder on one side. So there is a little bit of your gum is receding just a tiny bit. Okay. Do you find that you have some tooth sensitivity? Okay. Where exactly? Okay, let me just check that out here. Okay. Definitely. Okay. Not a big deal, not a big deal. Just check this side here. Okay. How does that feel? Is that alright? Okay. Good, good, good. I pride myself on being quite gentle, actually. Yeah. Once when I was younger, I went to a dentist who was doing exactly what I'm doing to you now. And she scraped my tooth so hard that she left an indent of this utensil. Yeah. It was so traumatizing as a child. Oh yes. I was lucky. I only had a cavity, I think, on my baby tooth when I was young. And then that definitely snapped me out of it. And since then I've been brushing regularly, as you can see. Sometimes our traumas actually are quite helpful. Oh, this is why I love doing what I do, creating confident smiles. Okay. Yep, oh, you can swallow. Okay, perfect. Well, I've scraped off quite a bit. I'm going to be giving you a quick rinse, so we're going to get all of that out, and then you're just going to be spitting to the side, okay? Yes, so I have this little device here. Yep, I'm just going to be rinsing each tooth individually and then just having you spit every now and then, okay? Alright, turning this on. Okay. How does that feel? Okay. Great. Okay, and you can spit for me, please. Okay, great. I'm gonna continue now. Okay, you can spit for me. Perfect, okay. Okay, spit for me. Perfect, okay. Going to focus on the center row now. Okay, spit for me. Perfect, okay. Okay, spit for me. Perfect, okay. Spit. Perfect, okay. Now just open really, really wide. I'm just going to get the, yes, exactly. Okay. Okay, and spit. Perfect, okay. All done. Yeah, you can slick your tongue over. Feels much better, right? Okay. So, I'm just going to give you an example of what I would like you to be doing, because I find that flossing, just your traditional floss, is very unrealistic for most patients. Yeah, it's very uncomfortable to constantly take the string, wrap it around your finger, and go in there. It can seem tedious or tired. I get it. Brushing our teeth is already a struggle from time to time, so just want to show you this. Yeah, you can go ahead and touch it. It's clean. Yeah, okay. So this is essentially a floss pick. So what this is going to do is, the string is right here. That's all you'll need for all of your teeth, unless you're having a particularly unpleasant day. You can actually use 2 of these, but what I love is that this has both sides, so the pointy side and the string side. So you can get in there with the pointy a little bit, then you can get in there with the string, and you can do the job for you. So I'm going to just demonstrate how simple and easy this is, and then I'm going to give you a pack to take home with you. Okay. Most of my patients don't like flossing. I hear it all the time, but this is a game changer. Okay, so I'm just going to get in there and floss your teeth for you. Alright? Okay, so open wide. Okay, perfect. Yeah. Yes. I know it feels funny. Yeah, so you're just really going up, wiggling, and down. Yes. Okay. Up, wiggling, and down. Okay. Up, wiggling, and down. Alright. Wiggling and down. Okay. Yes. I don't need to use the pointy side because we've already scraped that buildup from your teeth and rinsed, so this is just an extra step. Okay. Alright. Great, great, great. Perfect. Okay. Yep, you can swallow. I'm going to do the bottom side now, okay? Perfect. Yes, perfect, perfect. Oh yes, you see how easy this is? I know. Yes. I'll show you the string after, and then you can see. Okay. See? So there's just little bits, and then you toss this. Okay. Yep, it's perfectly fine. Yes, so if that's something that you think you'd be interested in, I'm going to give you just a pack free of charge, just so you can try it out at home, okay? Perfect. I'm also going to be giving you a toothbrush, because I think the one you're using is not quite soft enough. Okay, yeah. I can tell that you have a little bit of gum sensitivity. Okay? I'm just going to examine your gums really quickly, so once again, open wide. Okay. Yes, I can see that. Okay. Another side. Okay. Open wide. Yeah. Okay. Alright. Got it. Got it. Got it. Okay. Yeah. So I do see some sensitivity there. Not a problem. For the final step, we're just going to do a quick little rinse of what we've already been doing. So cleaning out all that floss for you, it's a really good idea to rinse. So I have this machine. This is essentially like a water floss. So it's just going to clean out some water in your mouth, but it's super silent. So open your mouth. Just gonna get in there between the teeth, okay? Just right in between, just to, yes, exactly, just to do a little cleaning. Perfect. Open wide. Great. Just going to do this side. And this side, okay. Alright. Looks actually really good. Your mouth looks actually super, super clean now. What a difference. Oh my goodness. Yes. And did you brush before coming here? Okay. I know, can you believe it? Most people do, to be honest. Yes, alright. Great, 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 great. So this is just going to be the final step in cleaning your teeth out, okay? Not so scary, is it? No, okay. Just going to be getting in there really well. Okay. Just wanted to get in there really well. Perfect, okay. Other side, great. Just being very thorough. Okay. Alright. Okay. So, almost finished with your oral hygiene here. I just want to make sure that I'm super, super thorough. So, I please examine your tongue? Yeah, can you just stick out your tongue for me? Great. Okay. Yeah, the tongue is usually an indication of what's going on. Okay. I think that you are a bit dehydrated. What do you say? Are you drinking enough water? No. Yeah, I can definitely tell from your tongue. Okay, look up. I'm just going to examine the roof of your mouth. Okay. Alrighty. Okay, and can you please close your mouth? Okay. Yes, okay. A little bit of dryness on your lips. Okay, open your mouth. Great. And say, ah. Yes. Stick out your tongue. Ah. Perfect. Okay. Alrighty. Have you ever used a tongue scraper? Okay, well, there are some toothbrushes with like a little bit of a material on the back that sort of mimics a tongue scraper. I wouldn't say you need to invest in a full-out tongue scraper at all, no. But just a toothbrush where the back side has that scraper, you should definitely be brushing your tongue as well. Yeah, it really helps with bad breath and things like that. Not that you have that at all, no. No, your mouth is actually very nice. You have actually lovely teeth, I must say. Just, yes, you can definitely just work on your oral hygiene just a little bit more, just to take it to the next level. You're actually a great patient of mine, to be honest. I rarely have issues with you. Yes, yes, exactly. So your wisdom teeth are looking okay. I see that they haven't shifted at all. Yeah, so they're fine. You don't need to worry about removing those at all. They're not hurting you or giving you problems. They're fine. Unless, of course, you want to. Okay. Yeah, we can do a more thorough exam next time. Just removing my gloves now. You can tell that the exam is over. Yes, well, you have been fantastic, fantastic. So as I said, just some final remarks. You should be brushing twice a day. But if you cannot, for whatever reason, late for work, school, so on, yeah, please just aim to brush before bed. It's really important. Okay. Yes. And flossing. How was that flossing routine for you? Not so bad, right? Okay, well, if you could just floss for me every other day, it would make a huge difference. Okay. I'm going to be giving you a toothbrush with softer bristles. Yes. Yeah, because I can see that you are a little bit violent when you're brushing your teeth, a little bit too hard. And that does really affect the gum, so there is a little bit of gum receding. Yes, which is probably causing some tooth sensitivity there for you. Okay. Not quite noticeable now, but these things do catch up to us as the years pass. So, yes, and unfortunately, tooth sensitivity is, other than using a toothpaste for tooth sensitivity, there's not much you can do. There's some gum grafting that we can do, but I find most of my patients just, exactly, yeah, for sure. Totally understandable. Not one to insist, but do be careful when brushing, not too hard. I'm going to give you a softer bristle toothbrush, extra soft actually. Not just soft, extra soft, okay? Yes, definitely. And as well, the back of the toothbrush is going to have a soft, yes, precisely. So it's going to have a little bit of that texture, so you can just scrape your tongue out after you're brushing your teeth. Scrape your tongue, give it a rinse. Okay, yeah. Now you don't need to use mouthwash or anything like that. If you're flossing every other day, for sure. And of course, there are other options. If you find that you do enjoy the flossing routine, you can switch to I'll show you. I'll just show you what I'm talking about. It's actually quite simple. So similar to what I used on you today, this is actually a water-based floss. So if you do find that you don't want to use so much plastic, string, etc., this is actually great because this one device, you fill it with water and it shoots the water just right into your mouth and it cleans your teeth. Exactly, so it really gets in there much like a floss would. So I highly recommend something like this, but this is definitely more advanced. Yes, definitely more advanced. So you don't need to invest in anything like this, but if this is something that you find you have use for, yeah. And this it's very gentle, you can use it even twice a day. So this is a good flossing alternative, but until then, I'm going to give you, as I said, a pack of these. Yes, exactly. Because these are going to be fantastic for starting out and just seeing how you like floss. So where the string is the first step, I would say this is the second step, and this can be the final destination when it comes to flossing your teeth. You know, I once read somewhere and it made me laugh, so I'll just share it with you, but I read that brushing your teeth alone is sort of like wiping your bottom, but never wiping the actual area that is dirty. Where flossing is like wiping the area that is dirty, if I can be so graphic with you. So you do really want to get in there and clean your teeth really well. Yes, so for you I'm going to aim for every other day, but we'll catch up in about 6 months' time, I would say. Okay, don't take so long to see me again. Perfect. Okay, so I'm going to leave a note with the receptionist giving you the floss, toothbrush, etc. So all of that stuff free of charge, of course. Okay. Yes. Fantastic. Yes, so you can settle everything with the receptionist, but it was so nice to see you again. Please don't take so long to see me again. Okay, as I said, I do care a lot about your dental hygiene. And for someone with such a lovely mouth, beautiful teeth, gorgeous, you should be taking care of them a little bit better, okay? Perfect. Well, not so bad. Visiting the dentist, is it? Not so scary. Okay. Yep, you wouldn't believe how many people are just not happy to see me at all. But I'm glad that you're feeling okay and this experience was okay for you. Perfect. Well, I will definitely see you again next time. So I'm just going to be making those final notes with the receptionist and leaving it out front for you, okay? So if you can just wait in the waiting room for 2 more minutes and then you can be on your way. Perfect. So I said toothbrush and floss, free of charge, with the tongue scraping toothbrush. Perfect. Okay. Oh yeah, you can go. Yep, I'll see you out there, okay? Yes, I'd love to say bye to you one more time. Alright, have a good day. Okay, bye-bye. Take care, bye-bye.